I'm Dr. Kanellopoulos, a board-certified eye surgeon specializing in cornea transplantation and refractive surgery. I have been involved with the research and development of LASIK since 1993. Great vision and offering medical excellence to my patients is my passion.
Well, a lot have changed since, and as you can see here, I've moved my practice from Manhattan to Athens, Greece, because of this technology. Wavelight technology was able to address angle kappa, topography-guided treatments which were performed outside the US, and of course, some of these indications are not yet FDA approved or practiced in the US, was shown over a decade ago to show advantage in visual rehabilitation, managing highly distorted corneas, even corneas with extreme distortion, such as ectasia and keratoconus. And this is all the work, dozens of papers that we have presented in all the major meetings and in peer-reviewed literature. And again, a lot of these treatments are not yet available in the US, but have been routine practice in Europe. And I'm extremely pleased that this technology can be available to my US patients as well. You can see the extensive work and reports we've done on the efficacy of this topography-guided technology, its ability to better center and even address cyclorotation adjustment to the full extent. From theory to practice, these young gentlemen, good sine-fluid imaging, myopia and high astigmatism. You can see here pupillometries are normal. The actual length measurements correspond with our clinical measurements. OCT and topographies are good. And I'd like to share with you our discussion with the patient on the possibility of topo-guided treatment. Welcome.
Thank you.
It's very good to have you here. We've had you in our office for over an hour. You gave us the opportunity to study your eyes very carefully. And now I have confirmed your prescription that you're wearing glasses and toric contact lenses. We're measuring basically the same thing. You're 3 diopters myopic in your right eye with 2 diopters of astigmatism and 325 diopters of myopia in your left eye with 175 diopters of astigmatism.
Dr. K, I've heard about these word custom topo-guided treatments. I know that I read in the literature you are an expert in that. Why would that be better as an option compared? I had friends who had LASIK, regular LASIK. They were very happy. They are very happy. So why bother?
We've spent a lot of effort and work in studying our results with topography-guided. For instance, I can simply explain to you this on your topographies. This is your cornea showing the astigmatism that you have. We can all appreciate that it's not perfectly symmetric. And if you place a standard treatment on this cornea, there will still be some asymmetry left behind theoretically.
The standard treatment is?
The standard treatment will treat, in your case, 3 diopters of myopia, 2 diopters of astigmatism in a certain axis. So that treatment will be on the top of the center of the cornea and the bottom of the center of the cornea the same. Here, if we employ topography-guided, the treatment will not be the same. The upper part will receive a little bit more treatment, and as you can see, a little bit wider than the lower part. And in essence, no human cornea is absolutely symmetric. Some are more symmetric than others. Yours are symmetric enough to consider them healthy, but we feel that topography-guided will offer you a significant advantage, and the data that we've collected and we've reported underline that. But not only in our center in particular, there is a big study for the FDA that shows that in a very large number of patients, randomized employing topography-guided in comparison to standard treatments, which as you mentioned are very good treatments, offers a better result as far as the visual function afterwards. In the laser, we can just dial in your numbers and get a treatment plan such like this, which contains 3 diopters of myopia and 2 diopters of astigmatism. And this is pretty standard. This is very efficient. It has proven through the years to give very good results. Having the technology available now, we designed a treatment which looks similar to this one. This is the topography-guided treatment. It's not exactly the same.
It's not as round.
It's not as perfectly round and symmetric, and we want to take that into account because the more symmetrical the result, the better the quality of vision. And something very significant, which is kind of rare in myopes and people who are nearsighted, is also that we have a little bit of angle kappa here. In few words, we have seen in our experience that using these data will of course correct the nearsightedness and the astigmatism. But in our experience, this will take it a step further and improve the quality of vision. A very large study done in the US over the last year showed that in a large number of cases, the gain in best vision was very significant by using this technology. But the treatment is essentially the same. The flap making will be the same. We lift the flap. We then have the device match your imaging of the eye at that exact moment to these pictures we've taken before. Our technician does the final pass through the keys of the computer. I give the final OK directly looking at the computer screen of this treatment, and then this treatment will take 3 diopters of myopia, 2 diopters of astigmatism. Will take close to 30 seconds to perform.
Okay, thank you very much.
Sure, you're welcome. Thank you.